And action. Hey, so Maria had a really good question today. I had seen her and we had a long discussion about ongoing knee pain. She's an avid hiker and has been suffering from every once in a while knee pain. Say twice a year, once a year to twice a year, but it would last about 3 months or so. So it would go away on its own. She came to see me because she wanted to have a workup and she's planning a big hike. Here's the thing, and she had a really good question. The question was, should I invest in physical therapy if it only lasts a little bit of time and I'm doing okay otherwise? And here's how I would explain it. So this is a knee. This is a right knee. And the right knee has a kneecap. It has cartilage, these round things. It has an ACL, this thing. Then it has the patella, which is this little part, which acts as a pulley for the quad muscles up here to pull the leg and straighten it out when you're running. So it kind of goes like that. I mean, that's the way it bends and that's the way it straightens. It's all dependent on these four muscles up here called the quad. So if the knee is working properly and all these surfaces are nice and smooth, should be bulletproof for 80 to 90 years. Now this one happens to be arthritic. I don't know if you could see that, but those are little divots. And they're simulated damage over the course of time. But same thing happens when we have knee pain and it's not going away. I sometimes consider, well, it's got to be a meniscus, it's got to be an ACL, it's got to be either the patella or the rest of the bone, the femur. If there's no other problems, then it has to be kinetics of the motion of the ankle below, the hip above, or some imbalance. But again, to address the question, do I need physical therapy if it only hurts every once in a while and it resolves? My suggestion is I always want my patients to shoot for a summit. Even if you're content with an exercise routine, even if you're content like me with a big hike in a national park once a year and exercising all during the year, I think it's still important to anticipate what's coming. The only constant that is in this office when I see patients is the fact that, number one, well, it's the only constant. So number one, and the only one, is you're going to get older. So in the case of Maria and a knee issue, if it's quiet and or just lasts 3 months, we can kind of get by, minimal pain, no medicines, no herbs. I mean, I like fish oil for joint pain. I like glucosamine sulfate for relieving inflammation and increasing range of motion. I like turmeric. So all those things are really good as anti-inflammatories for the whole body. Glucosamine sulfate in particular is supposed to be specifically for the lining of the cartilage of a joint, but even SAMe is supposed to increase range of motion, and its actions are really undiagnosed or unknown. We just use it and we notice people feel better. So sometimes if you don't have to take medicines, if they're affordable supplements, and if you don't suffer that often, yeah, the question is, do you have to invest in physical therapy? If you see my video on DrRic tutorial physical therapy, you'll see me interview Lori Hill. She's a physical therapist that works with Advocate Sherman. She's seen my wife, she's seen my patients, she's an excellent physical therapist and thinks outside the box. I usually send my patients to her for prehabilitation. That means exercising before the injury. Now let me repeat that, exercising before the injury. So it might seem like it's not necessary yet and you are investing time, but you're exercising, you're investing time to prevent the injury, or at least if you get into that age group where you're going to have more arthritis on an x-ray, you're going to have more aches and pains, you're going to get little muscle thinness. That usually decreases with less testosterone, less estrogen. You're going to get muscles that aren't as bulky as before. When all that stuff happens, you will become weaker and you'll strain the joint even more. So those episodes that are once a year or twice a year will become 4 times a year or 5 times a year. And at that point, if you wait for physical therapy, you'll be weaker, you'll be more fragile, you won't have as much energy, and then you're going to try to invest in physical therapy? No, you should do it now when you're healthy. It seems almost contraindicated that you start an exercise routine before the injury, kind of like watching your weight before the diabetes, or getting on a high fiber diet and fish oil or Mediterranean diet before the cholesterol, before the heart attack. I mean, in a sense, it is doing stuff extra, but it's because of the end result. We're trying to prevent the disease that's coming. And again, because I can't predict which disease is coming, but I can guarantee you you're getting older. And with age comes weight, with age comes cholesterol, with age comes increased risk for heart attack, stroke, cancer. So if you go into that age group with a bum knee, a high cholesterol, elevated sugar, or more body mass than usual, well, it's going to be hard to take care of it then, harder to take care of it when you're older than it is to take care of it when you're younger. So why wait? So I don't mean to be facetious with that, but I empowered Maria to consider really taking on this summit and maybe getting better so she can do more summits in a year or springboard into some weight loss. So I think that I'm trying to get the point across that prehabilitation is important. Watching your weight is important. Lowering your cholesterol, increasing your fiber, getting more omega-3s in, always important. Getting good sleep, always important. Controlling alcohol intake, decreasing cholesterol, decreasing caffeine use, always, always, always important. I can't stress that enough because usually when I see patients in the clinic, I think my forte is I can reverse engineer the disease so I can see where it started and hopefully recreate the lifestyle that was constant back then that make you happy and keep you healthy, and maybe apply that to this current time of life. If you reverse all your diseases and get to that lifestyle or that time of life, maybe the disease that you're coming in with will go away. If it doesn't, at least you tried, because I can guarantee you medicines that I use will work, but if you don't change your disease process, the medicines will eventually fail because the disease process will overtake that. It's called outrunning your medicines. So I always try to get to the root source of the disease process, and I think that's the best way to do it. I think physical therapy is a great investment, even if you're an avid athlete or avid exerciser. I still think if you have a professional kind of looking at you, watching you with a 30-pound backpack on, with your hiking boots on, watching how your gait is when you're in your sport, seeing how you move your joints when you're in an activity of daily living, I think that's the best way to utilize a coach for physical therapy or activity. And sometimes if you find deficiencies with the coach, even if you think you're okay, you work on those deficiencies, you'll be avoiding a problem in the long run. So Maria, good question. Thanks for asking. Please stay tuned and subscribe for further questions that I answer in Dr. Ric's Minute Clinic.